pretty, scary to be in a neighborhood where there's no hospitals nearby.
Oahu's West Side Hospital goes dark tonight as the last patient leaves the facility. Good evening, everyone. I'm Kenny Choi.
And I'm Laura Yamada. Well, it has been a day many have been dreading. Over this last week, Hawaii Medical Center West has been closing down floors of its hospital. And this afternoon, it shut down the intensive care unit where its last 5 patients were being cared for. KITV4's Catherine Cruz has the latest on this developing story.
Most of the hospital at HMC West is dark tonight. Only the administrative and finance offices remain open for now, but who knows for how much longer. Ed Downing's wife is a professor who trained nurses at the hospital and who must now do the clinical work elsewhere. He worries for his community.
It's in our neighborhood. We live across the street here.
His family has switched to Kaiser, and in the case of an emergency, they will have to travel farther for care.
And we have a Kaiser Permanente point. We have to go down to Mauna Lua. That's a pretty far ride. We're in pain. I don't know what the future looks like out here. A lot of houses, a lot of shopping centers, but we don't have a nearby hospital.
Lawmakers had been warned that HMC West would be the first of the 2 bankrupt hospitals to close. They remain hopeful for the long term that someone will step in and eventually reopen to serve the community. Hawaii Pacific Health has said it's interested, but formal talks with St. Francis, which owns the land and buildings, can't happen until the facility officially closes and the books and debt are cleared.
We're hopeful that one of our local entities will take over that hospital and hire back our local people and run it like a local hospital. And so we're looking, anxiously waiting what happens next.
The shutdown has put lawmakers on alert about the strain on remaining healthcare facilities and the fear about what could happen if another hospital gets in a financial bind.
We at the state were very concerned that if Wahiawa General or even Palimomia or any additional hospitals are unable to maintain their doors open, especially in the emergency room services, that would have a huge impact on the Leeward and Central Oahu areas.
This picture was snapped on this last day of patient care. No patients, no staff.
And we're told that that last patient was transferred at 2:30 this afternoon to HMC East. Hospital officials say that there are about 20 patients left at the Liliha facility, but finding beds for them has been a challenge, and the hospital's CEO, Maria Castillo, says she's asking other facilities to step up and help, as they had earlier pledged to do. Back to you.